I did not know.
Was he making reference to Dr. Adams?
Joining the team?
Joining the team? Did he say Dr. Adams? Or did you infer?
No, he's sitting right there.
Okay.
Yeah.
So he's going to be the second doctor on the team?
Yeah.
Okay.
And I was surprised that he was bringing that appointment without any warning. So I said, whatever you want. But he was familiar working with Dr. Adams before and getting the substance as one of his treating physicians for Diprivan. And that's what happened. So I said, whatever he wanted. So Dr. Adams continued to call me. And he left word with Mr. Jackson, who should I contact in case I want to go to England? Should I go to you? Or should I go to Michael? The says left to Michael. And Michael said, well, talk to Conrad and let him know what you want, and then we'll work it out. Well, at that time, even though I sort of somewhat agreed to go on the team, we were not in contract. We had not gotten the numbers. I know I had my practices. I mean, how do I close that down to make sense to go on a trip like this with the gentleman? And Dr. Adams did call me back, and then he said that he had spoken to his mother, he had called her, he had spoken to a friend, and he was single and available, and is on board, just called. So I said, what kind of income are you going to look for? He said,
is this important to you guys?
And when you're saying what kind of income are you going to look for, are you talking to Dr. Adams? Or
yeah, Dr. Adams. Is that
that's fine. Yeah, that's fine.
Sure.
Are you sure?
Completely skipped the important part.
We'll get back to it. I know. We'll get back to it, and that's fine. That's fine.
Okay.
I don't want to waste time.
Oh, no, that's it. We'll finish this subject.
Quite all right.
Yeah.
Mr. Adams, Dr. Adams, said that he had made about $600,000 in his previous year, working in Vegas with the minimum staff. The overhead was small, and he took him about $500,000. But if he had to make the trip or change and give up his practice, he wanted to have a commitment for maybe 3 years with Mr. Jackson, and he would like to have about $1.2 million, $1.3 million. That was his request. I told that to Michael, and there was no subsequent follow-up on that.
So he didn't end up joining the team?
No, but he said he was available. He kept asking, he kept texting me how are things going, and I just said, things are still...
For $1.2 million or $1.3 million.
Just for the trip?
Just for the tour. Exactly.
Yeah.
How long was the tour for?
The tour in England was going to be a year, but Mr. Jackson had said that following the tour, there were 3 or 4 movies already programmed with AEG to develop, for which he wanted me to still be around. He wanted me to be around forever. That's what he said.
Excuse me.
He wanted me to be around forever.
I took you for having a rap about it.
I'm sorry.
He wanted me to be around
It was a
forever.
vibrating thing, and then I couldn't feel it after a while, so now I got to hear it.
Yeah, he wanted me to be around forever. And he wanted to open the children's hospital where kids from all over the world can come and get treatment. And he wanted me to be the medical director, not particularly to see them, but to help to hire the specialists so I'd have the different departments run. And those were things that he had in mind for down the road. So that's it.
All right, we're going to get back on track. We're at about 10:50 hours, where you give him the propofol. We've gone into the history of how he already knew about it. He was the one who requested you for it, giving you some pressure.
Got milligrams, 25.
25 milligrams, half of what you normally get. What happens next?
I'm monitoring him at the house, and he fell asleep.
11 o'clock now, later.
He fell asleep fairly quickly, I would say, but he was not snoring. Normally, if he's in deep sleep, he would be snoring. I was a little bit hesitant that he would probably jump out of sleep, because that he does. He just quickly gets up like that, and his eyes goes and he's wide awake, and whenever he's up, he reaches for his IV site.
Real quick aside, because I'm not familiar, is this something that has to be continually introduced into him as a drip, or is it something that you just do a small injection and then
You do a
that's
small
all?
injection to help him to sleep, and then you try to drip slowly
Okay.
so that he continues to sleep.
It's like anesthetic. It's like a general anesthetic. In fact, it's used for that primarily before the gas goes down. A lot of times they'll have that drip. That's what he's been sleeping on for years.
But it's also used in the acute patients who are, very ill and they need to keep them completely sedated. It's being used.
Okay, sorry, didn't mean to interrupt. So he fell asleep quickly, but he wasn't snoring, so he's not in a deep sleep.
Right. I was worried about that because when he's on deep, then he could just quickly wake up. But I monitored him. I stayed there, watched. I monitored. Saw his oxygen saturation was in the high 90s, 98%. Heart rate was roughly in the 70s. Everything looked stable. I monitored him. I sat there and watched him for long enough period that I felt comfortable. But then I needed to go to the bathroom. So I got up, went to the bathroom to release myself of the urine, and also consider getting rid of some of his urination that he had put in the jugs overnight. And then I came back to his bedside and I was stunned in the sense that he wasn't breathing, because I always want to look at his chest and look at his diaphragmatic motion and all of those things. I looked at the pulse oximeter right away, and his heart rate was like 122 beats. That's what it was.
It's, to go to the bathroom, I know it's a huge house. I don't know where the bathroom is. About how long would that take to
Well,
go to the
based upon the
restroom?
room that he has, I leave his bedside, I walk through another chamber, which is like a dressing area, and then I get into the third vault, which is where the bathrooms are and where I can urinate.
Okay, so a couple minutes that you were gone?
I was gone, I would say about 2 minutes.
About 2 minutes, okay. All right, so do you have the impression he wasn't breathing and you said his pulse was high?
When I came back, yeah.
Go on.
To the bedside, my clinical observation. So immediately I felt for a pulse, and I was able to get a thready pulse in the femoral region. His body was warm. There was no change in color. So I assume that everything happened very quickly, just about the time I was gone, within that time I'm coming back. So I started immediately to perform CPR and mouth-to-mouth resuscitation.
Manually doing the CPR, or did you have a resuscitation?
First thing you did?
Well, I observed him clinically.
Did you apply any medicine or do anything?
Well, the first thing that I wanted to do, I did apply medicine, but not first. I wanted to resuscitate him.
Oh, sorry.
And the key thing is that if he was not breathing, I wanted to make sure I ventilate him and to compress him. I also know with CPR that the best thing you can do for a patient is to, if you don't even ventilate, make sure you do compressions.
Compressions.
So I started with his chest compressions, and then I swiftly went a single man resuscitation to ventilate him directly, mouth to mouth. I saw his chest rise appropriately and fall, so I knew that I was ventilating him and I'm getting oxygen into him, and then I would switch back to CPR. And while I'm doing that, I look at the telephone of notes. No telephones in that house works. Why is that designed so? I guess to avoid calls, because Mr. Jackson constantly changed his cell phone number.
Real quick, is he, are you doing CPR while he's on the bed, or did you move him off the bed?
I couldn't move him off the bed on my own, and I do.
I cannot have people going through this courtroom.
I'm sorry, sir. I've never worked. I didn't know. I'm sorry, sir. It's my fault.
Rita, I'm sorry for the interruption. Can we just turn it back a little bit? I know it's not like a regular tape. I'm sorry for the interruption.
Why is that designed so? I guess to avoid calls, because Mr. Jackson constantly changed his cell phone number.
Real quick, is he, are you doing CPR while he's on the bed, or did you move him off the bed?
I can move him off the bed on my own, and the quickest thing I can do is to try to get him ventilated and to do CPR. But what I did was to improvise. His bed is fairly firm, but still may not be firm enough for it to be very effective. So I got my left hand under his body, and I compressed with my hand not moving in place. And once I thought I had given him appropriate CPR, the house is closed. At night, it's just his children, he and myself are inside. Security don't come into his house to even use the bathroom. I'm told that they use a gas station around the corner. I felt that it was a little bit inhumane, and that week I spoke to them to at least let security have some access to a guest bathroom. Because when one guy leaves the door just 2 at night, you never know what can happen and you may need assistance. I don't think that took it. But anyway, I got my hands onto his back, in addition to doing CPR, and I ventilated him orally, and I made sure that his chest was rising completely with deep breaths and falling. Then, knowing that the phones don't work, I found that out a few weeks before when I lifted for dial tone and tried to make a call, and there was no way this phone was working. And I asked about that, and they said, well, the phones around here don't work. So having that knowledge, the only way I can get help is one. I know that he lives at 100 North Carrollwood. I don't know the zip code. To speak to a 911 operator would be to neglect him. I don't have that availability. I want to ventilate him, do chest compression, enough to give me an opportunity. While I got that done, I then continued CPR with my left hand, singularly, reached for my cell phone, and then called his assistant, which number I had, Brother Michael. I told him, Brother Michael, you need to send security up to Mr. Jackson's room immediately. We have a problem. Okay?
That's Michael Lemire, correct?
Yes, sir.
Okay.
I did not want him couldn't ask him at that time to call 911 because he would want to know what it was about. And I have a patient that needs help, and I'm trying to assist. And I'm trying to do it the best I can and to try to get help. I then returned after that phone call, I returned to his body with the same consistency of CPR and oral airway, mouth-to-mouth resuscitation. Recognizing that his pulse was, I didn't have a pulse now, I then lifted his leg, which can give you what is an auto transfusion. In other words, the blood in your legs, if you lift the legs, it can go back towards his heart. So I did that, elevate his legs just for a brief moment. I would love to have had it stay up, but I had nothing to prop it up. So I auto transfuse him as best as I can. Continue CPR, continue mouth-to-mouth resuscitation. No one came to the door. No one knocked the door. About a minute was gone. I did CPR, then I reached into the bag quickly, took a syringe and got flumazenil. Flumazenil. F-L-U-M-A-Z-E-N-I-L. Flumazenil.
Okay.
Yeah. Flumazenil is an antidote that could refuse the effects of a benzodiazepine. And the fact that he had gotten lorazepam, the fact that he had gotten Versed, I wanted to reverse the effects of those agents should they be working together now in addition to the milk that he was given. all in the effort of assisting him. I gave 0.2 milligram